Great. Well, good afternoon, everybody, and thank you for joining us for NAMI Maryland's 40th Annual Conference. My name is Brian Trees, and I work with NAMI Maryland, and I'll be your moderator for the session today. This workshop session is Community Action to Support Healthy Aging, presented by Shannon Skowronski from the Administration for Community Living, Erin Emery Tiburcio from Rush University Medical Center, Margot Quinlan from the Mental Health Association of Maryland, and Sue Luckenmeyer from the Maryland Living Well Center of Excellence. You can read more about our amazing presenters, including their full bios, in the digital conference program on the official conference website. The purpose of this session is to provide an overview of mental health in later life, the aging network in communities, and how older adults and their families and caregivers can access services that support healthy living and independence, and resources and training for professionals in aging and behavioral health. If this is not the workshop you meant to attend, please click the back button on your browser or click on the sessions button on the left-hand side of your screen to return to the full list of workshops we have available. We will be addressing questions at the end of the presentation. If you have any questions as the presentation continues, please post them to the Q&A tab on the right-hand side of your screen. We will be reviewing questions as they come in, and if something in particular is unclear or needs to be expanded, we will ask our presenters after the presentation has concluded. We are pleased to offer closed captioning for this year's conference. Captioning is only available for attendees using a desktop computer. To enable captioning, please click on the CC icon below the display of our presenters at the bottom of your screen. Once you click the icon, the video displays will become smaller and you will see the captions being generated underneath. If you have any comments, concerns, or technical issues, please post them to our chat and our technical assistant will address them accordingly. I'd now like to welcome our presenters for today's workshop, Shannon Skowronski, Erin Emery Tiburcio, Margot Quinlan, and Sue Luckenmeyer. Thank you so much for joining us today.
Thank you so much, Brian. And just give me one moment to bring up my slides. Can somebody let me know if you're able to see my slides? Because I cannot see you anymore.
Yes, we can see them.
Okay, great. Well, good afternoon, everybody, and thank you so much for joining us for the session today. I'm Shannon Skowronski, and I work at the Administration on Aging, which is within the Administration for Community Living in the U.S. Department of Health and Human Services. So I'm just going to provide a little context and sort of set the stage about why older adult mental health is something that we should all care about and that is important. So I'm sure that we all know that mental health is important at every life stage. But we know that 1 in 4 older adults has coped with a mental health condition at some point in their lifetime, and that COVID-19 certainly didn't help in terms of sort of anxiety, depression, social isolation being an issue, not just for older adults, but for all of us as we live through this. And there are also certain experiences in later life that are more common, that can be challenging from a mental health perspective, like the onset of chronic health conditions, disability, maybe experiencing a fall, the loss of friends or loved ones, is certainly something that is not uncommon or is more common later in life. I think the good news is that good mental health is possible at any age, and that there are things that you can do to help, and that for older adults, treatment does work if they're able to access it. So I'd like to share a little bit about ACL, which is where I work. ACL is a federal agency whose mission is to maximize the independence, well-being, and health of older adults, people with disabilities across the lifespan, and families and caregivers. And we oversee programs that invest in research on community living, um, oversee the delivery of services and supports in communities, and also are called on to serve as advocates. And we really believe that all Americans should be able to live at home with the supports that they need and really fully participate in communities that value their contributions, and certainly raising awareness of the challenges and needs that mental health issues in later life present is something that we've been actively engaged in at ACL, and recognizing that you know mental health conditions can make it a challenge to live in the community and to be fully engaged. So ACL works with what we call the Aging Network. So we fund state agencies who then fund service providers across the country. The Aging Network truly is in every community across the nation. You might recognize them by more common names like area agencies on aging, senior centers, Meals on Wheels, congregate meals. And the Aging Network touches 1 in 6 seniors each year with a variety of services, some of which are listed at the bottom of this slide. So this gives you like a sense of kind of the menu of services and supports that the Aging Network provides. This isn't an exhaustive list, but these are the most common services that you'll find across the country. Many of the services are offered free of charge to anyone age 60 or older who are the folks who are eligible to receive services. And the core services, as we call them, are funded by the Older Americans Act. You may be most familiar with the meals programs. They're called the home delivered meals are called Meals on Wheels in a lot of the country. And the goal of the meals program, the senior nutrition program, is to provide the meal to reduce hunger and food insecurity, to increase social isolation or to decrease social isolation and increase opportunities for health, wellness, and connection. Um, as I mentioned, the meals are provided in a home delivered or a congregate, so it would be a group setting. Um, and those that participate in the senior nutrition programs, we have evidence to show that they have better mental health and feel less isolated. So beyond the core services, there's two very specific programs that I'd like to mention. The first is the evidence-based health promotion and disease prevention programs. Excuse me. So these are programs that have been proven in research to help improve health and well-being in later life. And they're provided in a group setting, one-on-one in the home. Many are now available in a remote version, so via video conference or telephone or some combination. Um, and the programs focus on a variety of things like exercise, improving balance, so Tai Chi. Various forms of Tai Chi are a very common program that's implemented through this funding, and medication management. Several of the programs that we support through this funding focus on or have mental health focused components. And I've listed some of those specific programs on the screen. And later on, you're going to hear from Sue Lockenmeyer, who's at a community-based organization in Maryland, about some of their experience with the program to encourage rewarding lives for seniors, or the PEARLS program. I also wanted to mention the Innovations in Nutrition program, um, which really focuses on kind of implementing models to help improve the senior nutrition program, to make sure that the program is providing meals and wellness opportunities that older adults really want, and that they're able to, evolve and tailor their programs to the communities that they're in. I think that you'll find that there are certain things that are common across the nutrition programs across the country, but no one, when you've seen one, you've seen one. And there's a reason for that, because all communities are different. Um, One example of an innovation that was mental health specific that we focused on and funded recently was suicide prevention intervention, where senior nutrition program drivers in Meals on Wheels provided a brief intervention for folks who expressed suicidal ideation, or if there was concerns around that. I also included a link to the elder care locator here, which is really the online one-stop shop for folks to uh, get information about accessing services in their community. So Aging Network services, the ones that I had mentioned. You can go to the site and you can put in your zip code or your state, and it will provide a list of the organizations that provide aging services in your area. So we also support a few resource centers. And I mention only a few here because I think that these are probably the most relevant, and included the links as well. These slides will be available after the presentation. But uh, these centers primarily focus on providing education and resources for professionals. There are some resources for consumers as well on some of these sites. So I encourage you, if you have an interest, um, to take a look at these and explore some of the resources that might be useful to you. So for the past 5 years, ACL has sponsored an Older Adult Mental Health Awareness Day, and the date of the next day is May 11th, 2023. I've also included a link to the recordings and the materials for the event last year. Last year was an online event, and then the 2023 event will also be online. And really, the purpose is to, share tools and resources, and also stories from older adults and caregivers and professionals to about their experience living with a mental health condition, or providing support for those that are. Um, we are always looking for this event for older adults or caregivers who want to tell their story and their experiences. And so I really encourage you, if you have an interest in learning more and possibly doing that, to reach out to me, um, because it's something that I think is extremely important in any conversation about older adult mental health, is hearing right from consumers and caregivers. So my contact information is on the next slide. And again, I think these slides will be available post session for anybody that would like to download them and visit any of the links that I included. So I think that I'm going to stop sharing and pass the floor to our next presenter. There we go.
Hello. Glad to be with you today. My name is Erin Emery Tiburcio, and I co-direct the E4 Center of Excellence for Behavioral Health Disparities in Aging. And our mission at E4 is to engage, empower, and educate healthcare providers and community-based organizations for equity in behavioral health for older adults and their families across the U.S. So the work that we do is largely focused on older adults who have substance use disorders or serious mental illness or depression and suicide, and potentially where those overlap to either create or exacerbate physical health issues. And particularly for those who have low socioeconomic status and or are ethnic and racial minorities. I don't like the word minority, but the idea that we are attending to the needs of older adults who have mental health issues, who are the most vulnerable. And the work that we do at the E4 Center is largely educational. We provide resources to build knowledge, skills, and attitudes. I'll tell you a little bit more about some of those specific opportunities for learning that we have, as well as building partnerships. We have a toolkit on building partnerships across healthcare entities and community-based organizations to minimize the possibility that older adults are going to fall into that chasm between the healthcare system and the community. And we are just about ready to launch our newest toolkit around engaging older adults into mental health and providing the business case for entities to do so, engaging older adults in mental health and substance use treatment. We have a whole series on evidence-based programs, and while we don't necessarily directly educate older adults and families, we do have a number of resources that healthcare providers can provide. And I'll say a little bit more about some of the ways that we would love to engage you if you are an older adult. So a key piece here, and I think Shannon highlighted some of this, the idea that while older adults experience depression, anxiety, mental health issues in general, and substance use disorders at lower rates than younger adults, the burden of those illnesses is much greater for older adults. And so older adults with mental health issues are more likely than younger adults to have functional impairment, mobility difficulties, be burdened by the symptoms that they have when they go to the hospital, be there longer, and all of these health issues that put them at risk for loneliness. And certainly we've all seen the risks of loneliness in the news about loneliness being worse than 15 cigarettes a day for your health. So this is a critical population to attend to. And even with all of that, older adults are less likely than younger adults to pursue or engage in mental health or substance use, SUD is substance use disorder treatment. And part of the reason for that is that primary care providers don't screen older adults at the same rate for any of those issues and are less likely to provide referrals for treatment. And even with all of that, older adults are much less likely to survive a suicide attempt if they do attempt. So in younger adults, it's 1 in 25. So one person dies out of 25 people who attempt suicide. In older adults, it's 1 in 4. Part of the reason for that is that older adults use more lethal means, but part of it is just being less able to come back from any trauma. And unfortunately, even older adults with Medicare are less likely to receive adequate services, particularly if they are Black or Latino. And so one of the key ways that we are working toward meeting the needs across the spectrum of older adults is attending to the 4 M's of an age-friendly health system. So it turns out that in standard health systems, if we address the 4 M's, what matters to an older adult, asking what matters and making sure that we are aligning care with what matters, looking at the medication lists and trying to decrease the overall number of medications, as well as there are quite a number of medications that get more and more dangerous the older we get, so trying to decrease those. Under mentation, which is a terrible word, mind is a much better way of thinking about that, but assuring that we are attending in particular to depression and dementia and delirium. But then within a 4 M's behavioral health framework, assuring that older adults are getting screened for substance use disorder in particular and cognitive impairment, and assuring that we are attending to caregiver needs. And then in mobility, keeping people moving and addressing fear of falling, addressing the idea that the more we move, the more that we are able to manage our mental health. And so recognizing that all of these 4Ms interact with each other, right? So if we're on a medication that's impacting our ability to get around or to think straight, all of these affect each other. And so we are promulgating a new model of 4M's behavioral health across healthcare entities with support from SAMHSA. So we're excited to take that forward and be happy to talk more with any of you about that work. And I mentioned our cross-sector partnerships. And so in order to provide effective care for older adults, it really does take a team. And it really does need to have healthcare providers partnering with community-based agencies. Shannon mentioned area agencies on aging, senior centers, Meals on Wheels, a whole variety of different services in the community to assure that we're meeting the holistic needs of older adults, and particularly those who have mental health and substance use needs. And then coming soon, as I mentioned earlier, a business case for initiatives to improve behavioral health. There are some ideas out there in the general public that it's not financially feasible to treat older adults. Wholly untrue. And there are also incredibly effective ways to assure that the environment of care is welcoming and engaging for older adults. And thinking about, even just walking in the door. Is your lighting effective? Is your signage easily seen by eyes that have difficulty managing glare or managing the contrast? Having font that's large enough on signs and paperwork. Having chairs in the waiting room that have arms and no wheels. And so there are so many different ways that we can build that effective engagement and business case. So we'll be launching that in November with a webinar, and all of these resources are 100% free to all of you. We also have a foundational competencies in older adult mental health program. And we created this content and have offered it now in person. We just offered it in June, 3 days. We had these wonderful 25 providers come from across the country, had an actually great representation from Maryland, to learn about critical issues in older adult mental health through didactics, through discussion. There were exercises that people worked on together. And then providers had an opportunity to work with simulated patients to be able to practice the new skills. And everyone universally said that was the best part, to be able to practice, because they've never been given direct feedback on their work with older adults. And so we are very excited to be able to offer that again in May. So if that's something that you're interested in, you can keep an eye out for our offerings of that. In the meantime, we have also put the entire content of that program in an online format. And so this 14-hour online training program is available completely free to anybody who wants to take it. If you'd like to have continuing education credits, there's a low cost for that. And if there are a group of you from Maryland who would like to go in together, we can certainly get you group discounts. So far, feedback has been that the content of this program has been incredibly helpful in changing practice and in improving the care that is provided for older adults. We just launched this in August and already have had 175 learners come and join us. So we hope that you will come and join as well. And as you do that, you can also check out some of the other opportunities that we have for free continuing education. And some of those go through the basics of working with older adults. So going through normal aging, memory concerns, working in teams. And then the 4Ms modules, we have modules that we've created so that the first part of the module is for anybody who works in a healthcare system, stuff that everybody should know, from the person who works at the front desk all the way to physicians. And then we've got elements that are specific for clinicians. And all of that is free continuing education. We are also next Tuesday, in partnership with the Illinois Department on Aging, offering a 3-hour workshop on older adult mental health for community-based organizations. So the target audience here is folks who are not necessarily clinicians, but work with older adults regularly and would really benefit from knowing something about mental health and substance use disorders for older adults. So again, welcome y'all to come. Free continuing education for that event. We also have an evidence-based practice series that includes free continuing education from the nation's leading experts on the topics that we're talking about. And this year we're focusing on cognitive behavioral therapy. In December, we've got Greg Hinrichsen coming to talk about cognitive behavioral therapy for insomnia, which is incredibly effective for older adults, particularly when older adults should not be taking medications for sleep. Those medications tend to be very dangerous. Ann Steffen and Dolores Gallagher Thompson, who are nation's leading experts in teaching cognitive behavioral therapy for older adults, did a fantastic series for us last year on CBT for older adults. All of those recordings are available on our website. And in March, they're going to be doing a 5-part series on Beyond the Basics, addressing some of the common concerns for older adults. So you can come check out our calendar and join our mailing list to learn about the events that we have coming up. And one other key piece that we are working on right now, you've probably heard about the National Suicide Hotline shifting from an 800 number to a 988 number. We're in the process of creating 6 15-minute modules for 988 call center staff. And once we get those done, we'll be modifying those for a number of other non-clinician audiences. And lastly, as I wrap up for today, wanted to invite every single one of you, as Shannon mentioned, we're always looking for older adults who are willing to talk about their experience with mental health and substance use disorders. One of the things at E4 that we really want to do is get people talking, because the more we talk about this, the less stigma that is out there. And the more that we can get people of all kinds of backgrounds talking about just how important it is to access treatment and how much better life can be when we do that. So if any of you knows anyone who might be willing to make a video for us to share their experience to help older adults access treatment, we would welcome that. So with that, I will wrap up and hand off to Margot. Thanks so much.
Great, thank you. Let me put my slides up. Okay. Folks can see this, I'm assuming.
Yes.
Okay, great. It's always so disconcerting, just sort of talking into the computer screen, but I will do my best, and I'll try to go a little bit quickly because I know we want to save some time for Q&A, but just excited to sort of talk about some of the work that is happening locally in Maryland, to sort of build off of what was shared just before I went on. And again, my name is Margot Quinlan with the Mental Health Association of Maryland. And I help to lead our policy portfolios around older adult mental health. And I think first, before I get into some of the policy and organizing work that we're doing, I just want to share some of the resources, the local resources that we also have, because I think it's incredibly important whenever we're doing collective advocacy and organizing to also make sure that we're really tending to our individual personal needs as well. And so I just want to lift up some of the resources that we have on our website for individuals or providers or folks doing work in the community. If you just you could Google Mental Health Association Maryland and find it, or our address is on here. And we have a whole section of resources for older adult mental health. We have this really extensive guidebook that you can download and read it on your computer. You can also order print copies for free, and we'll ship dozens of these to folks if they want. And it just has lots of resources for again, families, for individuals, for communities, just trying to navigate either systems around behavioral health or community supports or otherwise. And so just want to make sure I lift that up as a free resource that I think is really helpful. We also are continuing some work on a peer-to-peer pilot project in Baltimore County. And we have links to some other county-based peer-to-peer sort of phone services in other counties across the state on our website. And so, again, just encourage folks to check that out if that would be a helpful resource to anybody. Again, sort of acknowledging that folks with lived experience, in any area, it's really can be the most powerful tool for us to support one another. And sorry, I keep looking at my clock if I don't know if people are looking at my face or my slides, but Just want to make sure I don't get too long-winded on any of this. And again, if you poke around on our website, and I'll make sure to share my contact information too, if anyone's looking for anything that's not there or can't find it. But, we do have a lot of information about, events and things happening and ways for people to get involved, other just information and resources on aging, on mental health, on cognitive health, on all these sort of intersections of our health and our whole body that, often present in different ways. And so just want to make sure folks know that there's kind of a wealth of resources on our website, as well as some of the others that were mentioned. Okay, so let me talk a little bit about the advocacy and organizing work that we're doing. And largely this is being done sort of in community and then lifting up priorities into the policy arena at the state level. So doing legislative advocacy in Annapolis. And so most of this is done through, we have a pretty large coalition on mental health and aging. It's open, and so if folks want to attend, again, just send me an email. I'll make sure to share that in the chat. And again, I think it's at the end of these slides, but I'm happy to have folks with lived experience there, providers there. We have clinicians and social workers. We have state agencies come to the table, our Behavioral Health Administration, Department of Health. And so it's been a really incredible space just to collectively bring folks together and sort of talk through what are the challenges, what are the things we're seeing in community, how are we really supporting, and we've tried to sort of zero in on supporting folks with pre-existing behavioral health conditions as they age, right? And so how are we supporting folks across the lifespan? But then also, for older adults who develop, later in life, depression, anxiety, substance abuse challenges, whatever that might be, like how are we sort of looking at sort of all of the sides of how these challenges might present for folks and how we can support them, whether it's with resources, but largely through policy change too. So just quickly to sort of frame, and I know some of this has been said, but I only have two graphs, and I didn't even make these, I stole them, but I put our one of our good partners, Michael Friedman, who leads a lot of incredible work, has put some of these slides together. And so I just wanted to lift up a little bit of the sort of, the urgency and the, who we're working for and what the landscape is here in Maryland, to just acknowledge that our population of older adults is growing really rapidly here, as is everywhere. But, we're seeing, really sharp increases in that population. And oftentimes, not to be too blunt, but like a concerning amount of apathy towards that from policymakers and decision makers in Annapolis. And so we really try to lift up the urgency of this, elder boom that is happening. And two, just to point out with this slide, our population in Maryland, it's becoming older and it's becoming more diverse. And so really wanting to acknowledge that, what is the year here? 2045, the population of older adults will be 50% people of color. And so really wanting to recognize too that there's a boom in diversity and a boom in just our older adult population. So I'm going to go very quickly, I think, through some of the policy things that have happened in the last year, but I really want to focus a little bit on sort of like where we're looking ahead. And again, try to wrap up in 2 or 3 minutes. But just for folks who don't know, I think the legislative process in Maryland is intentionally obtuse, but it can be pretty accessible. And so just to sort of share like kind of the high level of how it works, the legislature only meets for 90 days each year. We have a part-time legislature. And this last year was sort of a hodgepodge of, in-person hearings, virtual hearings. Personally, would say there's a lot of accessibility issues with, forcing folks to come and testify in, packed hearing rooms in Annapolis during a pandemic, but that's the world we're in. And not a lot of the virtual supports have been carried over. So it'll be curious to see if there will be more opportunity for folks to be able to testify from their bedrooms or from a assisted living center, from a residence that might preclude them from coming to testify in person. But that is yet to be seen. And also just to point out, it's sort of this flurry of in 90 days, there's thousands of bills introduced, a few hundred of them pass. And it can be a really, kind of cold, calculated environment. And so we really try to lift up, the urgency of the priorities that we're doing in those spaces and build pretty strong relationships with folks. I will this is on our website. I'll acknowledge this is, an offensive amount of words to put on a slide on a PowerPoint. So I'm not even going to touch this. I just kind of cut and pasted this. But just wanting to lift up some of our priorities. Again, folks can access some of this on our website. I'm going to click through that. I should have just cut that. And just talk really quickly about some of the things that passed that I think are exciting, just to sort of highlight like the resources that are happening for older adults in the mental health policy landscape. So supported decision-making, this passed last year, a way to really center the autonomy and decision-making ability of individuals and in community. And so really excited to see that. This is, we passed some budget language that hopefully will push some strong supports for pre-admission screening for folks going into Medicaid-funded nursing centers. And so making sure people are appropriately placed, so the right supports are there. Again, talking about sort of safety, and a work group was created to study practices for vulnerability and maybe having this registry. So how do we center safety and care in the work that we're doing for older adults? It was 988 was already mentioned. There's been a lot of sort of funding fights and implementation discussions about 988, and in a lot of this we're in conversations around all this crisis response, and a lot of money's flowing from the feds to the local level, and we're trying to make sure that older adults are centered in those conversations as well. And again, just a few other kind of high level bills here. I feel like I'm running over, so I'm gonna just kind of wrap up and just say, looking ahead, some of the things that I think are really exciting that are in conversations in our coalition and other places is sort of looking at the administration change and trying to see, can we have some, interagency cross-sector collaboration to really lift up the needs of older adults, and not just for mental health. How are we talking about housing, access, transportation, mental health, everything in these different dimensions, and having that at, sort of one table. And so hopefully we can push for some more long-term vision for older adults, and then looking at other resources like mental health advanced directives. Again, this pre-admission screening tool, trying to modernize some of the systems that we're getting CMS dollars to implement here in Maryland, but making sure that they're robust and supporting our communities. And again, really trying to root some of these crisis expansion efforts to support older adults. So again, our website is here. Folks should just poke around and then send my emails on there, but it's also here, and I'll put it in the chat, and just happy to share resources and plug people into the work if anyone is working locally and wants to get a little bit more involved in any of this work with us. I'm going to stop there. And pass it over to Sue. Thanks.
Hi, everyone. I'm excited to talk with you about some of the additional work that's being done on the Eastern Shore in Maryland. Slides, please.
Yes, I'm going to show your video now. So, I'm going to try to show the video on my computer. It doesn't want to cooperate. Let's try this again. Audio. All right, can you see it?
Yes.
Yep.
Great. Thank you.
Okay. And I'm going to hit play. Oops. There we go.
All right.
Hi, this is Sue Lockenmeyer with the Maryland Living Well Center of Excellence, part of an area agency on aging, and really excited to have the opportunity to speak with you today about some of the strategies we've used to address social isolation and loneliness. So if you're not familiar with an area agency on aging, there is one in every county in the United States, and they work specifically to assist older adults and people with disabilities living in their homes. And this is really a list of the kinds of information and resources that you can rely on through your county's area agency on aging. most all of them will have very similar services. We do have a dementia adult daycare that's a little bit beyond some of the other ones, but the other pieces here are things that you will find in every county as a resource for someone that you're working with. And this is just sort of an overview of the various programs, evidence-based programs that we deliver across the state of Maryland. And I really want to start here because we have worked continuously around trying to address social isolation and making sure that we were able to do screenings for social determinants of health to really ensure that older adults receive the services that they need. We always do encourage participation in virtual or in-person evidence-based programs, really to help people stay engaged and to reduce their social isolation risk. We often provide tablets, loaner tablets to folks who may be in the community and don't have one, and we're able to really link them, show them how to use the tablet, and then how they can access the internet, linking to their family and friends as well. And as I pointed out briefly, individuals with early stage dementia are parts of our program, and we readily welcome them, as well as everyone else who is in the 60 and older category. And individuals who indicate a lack of social support and or loneliness are referred to a program that we do a great deal with. It's PEARLS, the program to engage active and rewarding lives. And it's a program also to reduce depression. I do want to share with you some of the stories from the field. Shannon Skronsky of Administration for Aging had indicated that this would be helpful. So we do work with a wide variety of multicultural organizations to really reach deeply into the community. One of our strongest partners is the Chinese Culture and Community Service Center in Montgomery County. And they have really been able to tailor the program, particularly the program to the PEARLS program, to really meet the needs of their community. Early in the pandemic, I just want to acknowledge the creator of the PEARLS program, the University of Washington, really urged providers to adjust the length of time, the number of sessions based on client needs. So we really have been able to work through COVID to be able to make sure that we could provide services, helpful services to older adults and people with disabilities. So I wanted to share a couple of stories with you from the field. This is one of the clients I had who said to me, you know, her medical conditions don't define her. She can still learn to have a good quality of life, and she turns, a hard day, a difficult day into a positive thing by looking at something special, maybe looking at a new book, watching a new movie, going through recipes that she might use when she feels better. She said there's always choices, and you just need to think about what you want. Again, she said, I can't change my condition, but I have that choice to go beyond and make the best of it and move forward. And another of our folks was really challenged because her husband had dementia and she felt really overwhelmed by the increased demands and her inability to find affordable assistance. And in addition to that, her cat, her key pet and connection, passed away. So her PEARLS counselor knew that one of her fellow employees had rescued some kittens and was looking for homes. And so she asked the client if she was interested in adopting a new kitten. She found one that looked just like the cat she'd recently lost. And so those are connections that are now made. So Sunny the kitten is now bringing joy and sunshine to the client's days and is some distraction from her worries as well. So I'm going to turn it over to the rest of the team. I thank you so much for this opportunity to participate in NAMI's wonderful session. Thank you.
Okay. Thanks to everybody for the great presentation. I apologize for the echo there. I'm not sure what was going on, but we made it through. So we're opening it up now for some questions. Right now we have one question. This person is asking for thoughts on fighting the aging stigma. Put another way, I'm not old enough to need that, or if I do that, then it means I must be really getting old mindset. So that's an open question to the presenters.
So I'm happy to share a little bit. I think one of the things that we know when we use the Pearls program is it's also great for social isolation. And I think it's important to really meet people where they are, listen to what their concerns are, and really to be able to work with them to identify things that, really will help them to make slow changes. That's really a key to the Pearls program. And I think it really can work with somebody who's struggling with really sort of where are they and what it is they need and want moving forward.
I would add to that we have a lot of work to do as a society to deal with ageism. Ageism is the most pervasive ism that exists because it affects every single one of us. And so as we think about aging, this idea that it means I'm getting really old suggests that getting old is bad. And so interestingly, research out of Yale demonstrated that when we have these negative perceptions of aging, we live 7.5 years shorter. So we have 7.5 years less to live if we think about aging in that way. And so the degree to which anyone listening to this conversation today can have conversations about aging and starting to think about the wonderful things about aging, because the idea that we're able to shift that, hey, aging is actually a really good thing, because the alternative, not so great, right? Not being here. And so thinking about, and even in those examples of going to a senior center or, other kinds of things, to think about what's important to you in your life. And how can you live most consistently with that? So if what's important to you in your life is socializing, and there are people who enjoy doing the same kinds of things that you do who happen to be in this building, and maybe that building has a sign out front that says senior center, well, what does that mean to you, right? And so the more that we can help people do what matters to them, whether it has a label on it about old or young or whatever it is, I think that's a lot of the work that we can do, that aging doesn't have to be associated with frailty and pain and negativity and all the other things that we slap those labels on. And so thinking about that, as you use language and as you talk to those older adults about those older adults, we are all aging adults. So as we age and think about that, would really encourage us to think about, well, what matters, whatever age we are, what matters to us right now, and how can we live consistently with that? See, Sue, I can pontificate too.
Anybody else have anything to add on that? I see words matter. That's certainly true in the chat.
They really do. And since we don't have another a question in the Q&A, I'll just make a quick comment about reframing aging, which is a phenomenal initiative that really focuses on this idea of language and the idea that when we talk about elderly, that word in and of itself brings up ideas of frailty and wheelchairs and disability and all of these things that we have these negative connotations of. So when we shift to words like older adults, Usually people are talking about active retirement and travel and other kinds of things that thinking about our language can go a long way. And also that inclusivity of every single one of us is aging. Every single one of us is in this same life space, regardless of the number that is attached to the number of years that we've had on the planet. So thank you, Dr. Thomas. Yeah, words matter.
Okay. It looks like we don't have any more questions. Margot or Shannon, did you have anything before we conclude? And if you have a question later, you can certainly send questions in the name of the session to connection@namimd.org or submit your question at the end of the event evaluation later this afternoon. But Margot and Shannon, anything to close from your end, your perspective? Not to put you on the spot, I'm sorry.
Shannon, you're on mute.
Uh-oh. Shannon, we can't hear you. You're still on mute. Okay.
Well, I don't have anything else to add while Shannon figures that out. It's just been great to sort of be in conversation with everyone here, and really appreciative of the sort of advocacy community here in Maryland and all the work that's been going on nationally to support the work here that we do as well.
Yes,
Great.
and I would just really encourage people to reach out to your area agency on aging, absolutely, regardless of your age, to find out what resources and services are available. As noted by Erin, everyone's getting older every day, so finding out what options you have, planning ahead, can also be a very positive thing.
Okay.
I do see another question in the chat that I could speak on if we have time for it.
Yes, please. Sure.
Okay, so somebody asked about specific policies or legislation focused specifically for the mental health needs for older adults in the LGBTQ plus community. And I can just share at least some of the work happening in Maryland around that. I think, there's a lot of components to it, and so much of it is, again, like sort of speaking to this holistic need of all older adults, right? There's like, I hate to use the words, but there's a little bit of a sort of like a trickle down effect with some of these policies, right? But also I think there needs to be, there need to be very explicit policies when it comes to equity, and if we're talking about specific population needs. And so some of the things that I know we've been in conversation with some of our partners. So Free State Justice is a legal organization that does LGBTQ advocacy here in Maryland, and they've presented at our coalition and have been speaking with some of the AAAs about ways that they could be supporting some of the local needs and making connections just for resources, because so much of the need for that community is really just in its community resiliency. And so how do we make connections, whether you're in Western Maryland or Eastern Shore, and find folks with shared experiences? There's also some pretty big legislative pushes around expanding Medicaid access for gender affirming care, which would have a big impact on older trans folks who might be seeking to medically transition and find other medical supports. And so that's been a big legislative push. And then there's been some conversations too around residential settings and if or how there might need to be more protections for folks to be able to sort of age in the appropriate gender-based units or locations. And obviously with an explicit eye on LGBTQ folks and trans folks. So a lot of sort of conversations I think have been bubbling up, and there's some new groups that have been forming to really specifically talk about the needs of older adults in the LGBTQ community. So I think a lot happening there, and it feels like there's more and more energy, which has been exciting to see.
Yeah. And just to tag on to that, I really encourage everyone who's listening, who's working with older adults, please encourage those individuals to go out and vote.
Got a thumbs up on that one. We had another thought that came in that said there are some aging adults who do better continuing to work, purpose meaning something to do, etc. Yet some of those same adults have an idea that retirement is what they are supposed to do, what they've been working towards. Those of us around these folks can easily see that retiring would be detrimental to their mental health, how to convince these folks to continue working in spite of their mindset, especially when part-time, a different job is not an option.
Yeah, it's so interesting. So I'm in now, I think, my 7th retirement. It doesn't work very well for me. And my boss knows that as long as I feel like I'm doing something meaningful and I'm having fun, I'm going to stick with it. So, again, encouraging people if they're currently working to, and they find it valuable and rewarding, absolutely, to have them continue to do that in a way that will work for them.
I would echo that and just come back around to the idea of what matters to them. And so whether they are working in the same job that they've been doing or feel like they need to transition to something else, to just have a plan to make sure that there's some kind of structure for the day, doing stuff that matters to them. And whatever that matters is. And, there are a lot of folks who, okay, at 65, I want to be done working, or 75, or whatever the number happens to be. Okay, well, then have a plan for what else work is going to look like. And, whatever occupation is going to look like, doing something that's meaningful. And so, there are a lot of people who fail at retirement, like Sue, and have come back to have, very exciting and successful careers, which is awesome. And sometimes there are, several careers. So come back to focus on what matters and make sure you're doing that.
There you go.
Okay.
2 thumbs up on that one.
All right. Okay, well, that's all the time that we have for today. So thank you, everybody, for joining us, and certainly to the presenters. At the end of the